So without showing the patient information, here's what ambulance charting looks like. I have one at White Deer with my name on right now, none at New Berlin, one at EMTS. But this one's already done. I did everything on this one. So I have to fill in where we're coming from, what time it is, if we use lights and sirens, how the patient got onto the stretcher, how they got into the ambulance, how many straps we secured them with, why we were transporting them, all the patient's information, birth date, phone number, age, all of that. Like here, CMS transport region, patient was transported for the care of a specialist or for availability of equipment. Ambulance service was medical necessary. Patient was moved by stretcher. Down here, I have to do like a blurb, abdominal pain, and then I have to do a blurb like ambulance 19.5 dispatched by round trip for hospital transfer of 56-year-old female with cholestatis and pancreatitis. Yesterday, a patient had self-admitted to Geisinger-Bloomsburg with severe 6 out of 10 abdominal pain radiating to shoulders. Geisinger-Bloomsburg diagnosed patients with both cholestatis and pancreatitis, then referred to GMC Danville for required higher level of care. BLS ambulance transport required because patient is unable to tolerate sitting position, has O2 applied, unable to self-administer, and needed monitoring while being transferred to higher level care. Scene information: patient in Fowler's position on bed in room 8 at Geisinger-Bloomsburg Emergency Department. Nothing abnormal observed regarding scene, patient, and immediate surroundings. First agency on scene, yes. Number of patients, 1. Glasgow Coma scale, she was 15. You got to do eyes, verbal, and motor. Pupils, normal, reactive, all that. Airways, that clear? Respirations, how's that? The cardiovascular information, pulses, any injury, and this is a whole list of stuff that you're supposed to check. Skin, head, face, neck, chest, lung, goes on and on and on. Thoracic, lumbar, this is a long one, not going to read it out. Mental status is oriented, person, place, time, and event. Normal baseline for patient. She doesn't have any of these other situations like combative, confused, hallucinations, all that. Whole list of stuff there. You need what system has issues, what the symptoms are: abdominal and pelvic pain, back pain, breathing problems, abdominal pain problems, and whether it was lower acuity or higher acuity. And then finally, after all that, we get to vitals. And here's where we go into vitals. Like ambulance 19.5, well, let's go to like the third. I got 2 sets of vitals in there from the hospital. Then like I got to put stuff in like patient observed in hospital bed inside room 8, patient under care of Geisinger-Bloomsburg nurse, patient in Fowler's position that shows no obvious signs of discomfort. IV line was capped, cardio monitoring lines removed prior to patient moving to stretcher, which she did by standing, walking, and pivoting to seat herself in stretcher with minimal EMS assistance. Patient blanketed and secured with 3 straps. EMS could return stretcher to ambulance and locked in place. And then down here I got to put like any vitals I took, all this, and I have to write like blurbs of what happened. Second blanket patient on patient, temperature adjusted for patient's comfort, and it just kind of goes on and on. And then what will happen is there's a quality assurance team. Like even here at the end, I put rails up ×2 once we got into the hospital bed at Geisinger, or report. We provided a receiving nurse, and receiving nurse confirmed written report had already been received from Geisinger-Bloomsburg. Normally we need to do the written report if it's a 911. So you got to do all this stuff for a chart. It takes a little while, and then what happens is you'll get flagged. The quality assurance team will go through it, and they'll find anything that's missing, and they'll question you on it, and then you have to go back in and fix it. So if I take extra time to do it right the first time, then I don't have to try to remember stuff later. But sometimes I still forget stuff. Last night I forgot to take a temperature on that patient, but I did have Geisinger's temperature from 3 o'clock, so I'm hoping QA lets it go through with that. But just to help you guys understand, I'm not goofing off. This is a lot of details and takes a lot of time. All right, love you, bye, have fun shopping.